everyone. Welcome to Close Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Janice Marie. On each edition of our show, you have the opportunity to meet some of the most innovative business leaders in the country today. You'll find out what their products, services, technologies, and business models can do for you, and what they're doing to change our world and to change the way we do business.
You know, it's a fact that people from all walks of life in virtually every conceivable occupation, from doctors and lawyers to nurses and housewives, as well as taxi drivers and blackjack dealers, and even athletes and the elderly, often suffer from aches and pains that can be extremely debilitating and very, very painful. And finding relief has often been just as painful in experience, going from doctor to doctor and a wide variety of exercise therapists, and often finding little or no relief at all. But for the fortunate people who have discovered this facility, the Advanced Manual Therapy Institute here in the Las Vegas Valley, the experience has been much, much different, and most, if not all, have come away feeling much better. And there is a reason for that. It lies in the educational background of the husband and wife team of doctors who own and operate this facility, and the team approach they bring to the comprehensive treatments that are offered here in this facility, which attracts clients from as far away as California, the East Coast, and even Europe. To learn more about it, we spoke at length with the two partners, Dr. Michelle Rantisi and Dr. Jody Stafford.
Advanced Manual Therapy Institute started in '05. It's a dream that me and my wife both had, even when we were going through school. We treat a whole variety of ailments, but we do specialize in orthopedics. We love the spine, we love the neck, the back, all orthopedics really. We do dabble with pediatrics, geriatrics, and neurological patients. We do have a few of those. But our love and our heart is with the orthopedics. We just love seeing how much they recover and how much they appreciate it. We're the only facility that has dual credentialing therapists that could actually work on both sides of the fence, do physical therapy and occupational therapy, and give good quality care for that patient. This location has been built by us the way we like it, and just to fit the perfect sequence of coming in, being seen in the rooms, coming out of the rooms, into the gym, from the gym, out the door with your home exercise program.
I came to them for the problem, sitting and getting up. Mike immediately diagnosed what the problem was and worked on me. I got all better after about 6, maybe 7 weeks. He taught me what to do at home. I still do those exercises. My thigh, they actually massage, move the muscles around, do what they need to do. And they teach me then how to sit, how to get up, and how to not lock my knees. They teach me methods that will help me instead of cause pain.
I have my doctorate in physical therapy, which mainly focuses on more musculoskeletal dysfunction. I have my master's in occupational therapy, which focuses on activities of daily living, instrumental ADLs, which are leisure activities, making sure a person can return to full function after a traumatic brain injury, a stroke, just a total hip or knee. How can they dress? How can they get on and off the toilet? How maintaining their hip precautions. I also have my manual therapy certification, which is more hands-on mobilization, manipulation, being able to assess all joints of the body, how they're moving for physical elements. And then I have my certification in ergonomic assessment specialist, do evaluations, what their occupational task demands are, and I set up the work station for most body efficiency to prevent further injury or overuse syndromes.
I have a knee problem for over 20 years. Actually, I have a pretty serious knee surgery about 8 years ago. The doctor told me that I need to have a knee replacement surgery in 10 years. I went hiking in Mount Charleston in October last year. And when I came down the hill, my left knee started hurting. And by the time I get back to my car 2 hours later, I could hardly walk. My wife knows somebody in the hospital. He heard good things about AMT, so I decided to give it a try. And after a couple of weeks, my knee started to respond very positively to the treatment. So I decided to delay the surgery. Looks like I can avoid this total knee replacement. And I feel much better now. All my knee pains are gone, and I just feel so much better.
You know, physical therapy is not really known as something that you bring a lot of children to, pediatrics, as you refer to them. What do kids come in here for?
Many different things. A lot of the kids that we deal with have neurological issues like cerebral palsy or mental retardation, or some things that happen during birth that cause them to have problems and complications as they grow up. And then we have the other set of kids who are just sports oriented. And what we're seeing as therapists is a lot of the kids are injuring themselves a lot earlier in life. So whereas a lot of these injuries were common in our teenage to early 20 years, we're seeing them actually showing up in teenage and pre-teenage years. Back pain, foot pain, neck pain, shoulder pain, nerve pain. This whole combination of life in general is causing the kids to become more unhealthy. Diabetes, obesity are all big epidemics in kids these days. All of these all relate to physical issues and physical problems that we might be dealing with in this clinic.
When I was about 21, I had knee surgery. I had torn cartilage. And I played soccer in high school and in college. And my knee was always, I had chronic knee pain. And even after the surgery, it didn't solve my problems. And my mother said to me, you know what, you should try this place, this physical therapy place. I'm like, Mom, I'm not going to one more physical therapy place. I've gone to like 400 in my life, and I don't need someone to tell me what machine to go on next. It's ridiculous. I came in here with a total chip on my shoulder. And Mike did the evaluation. He said, oh, I know exactly why you have knee pain. And no, you don't need knee surgery. And I'm like, okay, whatever. Guess what? Today, I don't have knee pain when I play doubles tennis. They have taught me to be self-sufficient, where they want you to leave. They want you to get self-sufficient where you no longer need them, where I want to stay forever because it's an amazing environment here, and they don't just help your knee get stronger, they work on your core strength.
It's interesting being here in Las Vegas. Do you have a lot of dealers who come in here with hand problems?
I have dealers that have hand problems, shoulders, elbow, as well as some with just Achilles tendonitis, bone spurs, from standing on hard floors, improper back strains and problems, just from standing in improper positions for a long time. Bartenders, sometimes you'll see declarins just from pouring drinks, overuse, repetition, long hours, bilateral hand use. The biggest thing is overuse that you'll see. You'll see median nerve impingement from it. You'll see tendon injuries or tennis elbow.
The whole experience has been positive, not only because my shoulder, but them helping me with my posture and just daily things that people do that you don't realize that really hurt your health over a long period of time with your neck, whatnot, your back. They've been able to kind of steer me away from those things. Things that everybody does when you're at your workstation, on your phone, at your computer, and you're hunched over and everything. So just changing my chair at work, rearranging my workstations, getting a headset, small things that I'm sure have helped me get back on the road to success and getting back to being able to work out like I have been today and not having pain.
We like to know the full medical history, we like to know all their medications, we like to know how everything in their life is set so we could work our physical therapy around their life without impeding with them. So that we do the evaluation process. That takes about an hour and a half, and then most of the time we start treatment right after that, and just a lot of education. That's the biggest thing we do, is a lot of education, because the lack of education led them to this place. Almost every one of our geriatric patients, you could pinpoint their pain to things that they were doing all through their life, repetitively, holding poor posturing. Over the years, it just accumulates and accumulates and accumulates until it just, the straw that breaks the camel's back. We are trained to use our hands, a lot more than doctors are trained to use their hands. So doctors rely more on testing to give them the answers, whereas we rely more on our hands and what we feel and what our special tests show to give us the answers. There's been many times that I find something and I call the doctor and I let them know what I'm finding, and then they go have an MRI and they confirm that that's what's going on. I would like to say our hands are pretty skilled at seeing beneath the tissue, seeing beneath the skin. X-ray vision pretty much through our hands is just, but that comes with time and training.
I fell and I broke my left elbow, and I had 3 fractures in my hand area. I have cast in my hand I have for about a month, and my elbow was in cast for about week and a half. After the cast was removed, the elbow was kind of frozen in 90-degree angle. I did have a physical therapist coming to my home trying to help me with that, and we were really not going anywhere. It didn't help at all. Accidentally I found this place, AMT. I decided to start coming here for therapy. I met Jody and Mike, the young doctors, and they did evaluate me and they told me that they can help me. So I decided to try. My arm is now much better than it was. Like I said, it used to be like this. Now I can almost stretch almost completely.
The big thing is we won't progress somebody until they get the basics first. And I think other clinics kind of miss that. They're not seeing professionals with professional eyes and skilled professionals on a daily basis, and they're pushed through, and a lot of times they just feed into injury.
A look inside the unique treatments and therapies that are offered here at the Advanced Manual Therapy Institute that has allowed so many clients to find relief from problems they have been unable to find anywhere else. It's obvious the process here really works. I'm Doug Llewellyn reporting from Henderson, Nevada.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.